I too thank you, Count Corner, for giving us this topical. Minister, many constituents and myself listened to the head bit from National Parks and Wildlife Service on Morning Ireland recently, and the case he made for not issuing the licence for netting hares was absolutely comical. Firstly, the NPWS official said that during the programme they were only dealing with this disease for 6 weeks now, although at the beginning he said our colleagues in the UK were aware of it for over 2 years. Why did the NPWS not take action when they were aware 2 years ago that the disease was so close to our shores? I want an answer. Secondly, he said that the disease can be spread by nits and boxes. Does he know? He said he knew this from his colleagues in England. And if so, why did he not advise the ICC last year to disinfect all nits and boxes? Thirdly, he was not asked, and this should just avoided the question, to say that a vaccine is now available to stop this disease spreading. Fourthly, if this disease is so dangerous to the native Irish hare and can be spread by humans vis-à-vis infected grass on their shoes, why did he say that we have only taken steps to introduce disinfectant footbaths in national parks and Scattery Island? Should a nationwide campaign not have been introduced, as was the case with the foot and mouth disease, to have all farms and people visiting disinfect when arriving and leaving? What's going on here? There are too many questions here, Minister. If he's saying that the disease is only confined to the national parks, and fifthly, and more importantly, why are the NPWS not asking for a cull of all rabbits within the 5-mile radius of the affected areas, gassing as was the case with badgers during the bovine TD epidemic? What is going on in your department, Minister? And many people are suspicious out there. Rabbits are classed as vermin, so the obvious reason for not culling or for calling for this needed cull is the fact that this would upset greatly those involved in the animal rights movement. There are too many unanswered questions here, Minister, and there's too much subterfuge and I call it deceit. And we want answers now to allow the coursing clubs have their licences to bring in the hares and see how healthy they are and vaccinate them if they have to.
Can we hear the Minister now, please? Thanks.
Thank you, Ceann Comhairle, and I wish to thank the deputies, both of you, for raising this important matter. And at the outset, I think it's important that the House knows that it should be aware of the potentially devastating impact of rabbit hemorrhagic disease. And this disease, as we know, was first reported in domestic farmed rabbits in China in 1984, and it killed millions of animals within 1 year of its discovery. And in 2010, a new and more virulent strain of this virus, which is known as RHD2, emerged in France. It caused death within a few days of infection, with sick animals sometimes exhibiting partial paralysis and bleeding from the eyes and mouth, and on other occasions showing no external symptoms whatsoever. And most distressingly, in the latter stages close to death, animals often exhibit unusual behaviour, emerging from cover into the open and convulsing or fitting before dying. And this virus has been detected throughout Europe in wild rabbits and hares. And the Irish hare, I have to stress, is native to Ireland and it's found nowhere else. And should this disease prove as infectious and as lethal here as it has done elsewhere in Europe, the impact on the hare would be, quite frankly, catastrophic. And RHD2 has been seen in wild rabbits in the UK for a few years, as you mentioned, and the brown hare has also been hit by RHD2 in the UK, and mortality rates in some areas saw up to 70% of the brown hares wiped out completely. RHD2 was first confirmed in the wild here last August, which isn't that long ago, and the first two records came from rabbits, one in Wicklow and the other in County Clare. As you know, deputies, I issued the licence on the 1st of August and I had to suspend it on the 9th of August. The first positive report from an Irish hare came on the 9th of August, which was an animal found dying in the Wexford slobs. And since these initial incidents, a request for public involvement has led to more than 50 reports of rabbits and dead hares around the country. And each report has been followed up by the local National Parks and Wildlife Service rangers. And from these incidents, the disease has now been confirmed from 6 different counties: Cork, Clare, Leitrim, Offaly, Wicklow and Wexford. There is no rhyme or reason to that. That is simply where they have been found. They could have been found in any county. There is no cure for the virus, and although pet rabbits can be vaccinated against the disease, it hasn't yet been tested on hares. And clearly, there would be some difficulties in the context of vaccinating animals in the wild, there are potentially 233,000 hares in Ireland, in addition to 2 million rabbits. And in relation to coursing, I would point out, and you mentioned the Irish Coursing Club, I would point out that the hare's coursing is administered by the Irish Coursing Club, which is a body set up under the Greyhound Industry Act 1958, and statutory responsibility for that act resides with the Minister for Agriculture, Food and the Marine. And licences are required by the ICC under the terms of the Wildlife Acts on behalf of their affiliated clubs to facilitate the netting and tagging of hares for closed park meetings. And as I said earlier, I had actually issued the licence for the 2019-2020 season in late July to the ICC, allowing its affiliated clubs to net hares for the purpose of hare coursing for the season. The disease is density dependent, and that is, the higher the density of animals, the higher the incidence of the disease. The virus is also extremely resistant, remaining viable for up to 2 months in the environment, and it can be passed on by direct contact. You mentioned, I think, by shoes, by faeces, urine, and infected carcasses can harbour infective virus for several months post-mortem, and it can be transported on soil, on shoes and on clothing.
Thank you, Minister. The balance of the reply will be included in the official record.